Hi, this is Dr. Sridhar Vennamaneni with Prathima Medical Center in Kukutpalli, Hyderabad. Today we'll have a small discussion. I'll have a quick talk about the new variant of COVID called the BF.7 variant. I'm sure you all have heard of this variant causing severe infection in China at this point. In China, from what we know, most of the people have not been vaccinated, and also the people have not been exposed to previous variants of COVID. So this variant has been causing multiple severe spread of infection and hospitalizations. So what is the difference between this variant and the previous variant is one of the things that we'll talk today. Also, I will give you some of the way to differentiate between this new variant and the influenza flu virus as well as the common cold virus. So starting with this new variant, the main features of this infection are the way you get this infection. It's a sudden onset of infection compared to the previous variants. Now, if you looked at the Delta variant and the Omicron variants, what we saw was that once a patient was exposed to this infection, it took a few days, 2 to 3 days, for a patient after an exposure to get an infection. With this new variant, what we see is that once the patient is exposed to either a carrier of infection or somebody who's been infected with this BF.7 variant, we find that the patients get infected and they start getting symptoms within the same day. It will be a small incubation period, could be within few hours to less than a day. So you could get infected very quickly. That's one of the salient features. The other important things that we all need to understand is that this infection can quickly spread. Now, if you looked at the previous variants like the Omicron, once a patient is exposed, they could give the infection to approximately around 5 other people. With this new variant, what we see is that one patient, whether it is a asymptomatic patient or symptomatic, could expose up to 10 to 18 patients with this infection. So it spreads quickly, it spreads quite rapidly. And the other features of this infection is that irrespective of whether you have been vaccinated or previously infected, there's a chance of you getting infected with this new variant. Now, what are the common symptoms in terms of presentation? The symptoms are pretty much similar to your previous COVID variants. Patients can have fever, chills, headaches, fatigue, sore throat, cough, small shortness of breath. A small percent of patients can have gastrointestinal symptoms like diarrhea, abdominal pain, vomiting. If we want to differentiate this infection compared to the influenza, which is a common flu infection, or a common cold, the way to differentiate is that with this infection, you'll have a sudden onset of fever. Common cold, you typically have mostly like congested sinuses, congested head, some mild muscle aches, maybe a low-grade fever. Whereas with this, you get sudden onset of fever, cough, shortness of breath, or a headache and congestion. So it's a sudden onset. The other differentiating features are in this infection, you could, just like your previous COVID, you could have loss of taste and smell. Whereas in a typical flu, you would get fever, sudden onset of fever, muscle aches, joint pains, but typically you wouldn't be losing taste or smell, and so that's an important feature. Now, when it comes to in terms of prevention, how do we prevent this infection? Or before I go to prevention, obviously, how do we diagnose this infection? At this stage in India, we have close to 200 cases of this infection. And it's just a matter of time before this infection spreads all around, and we'll see a surge in infections. The good thing about this infection is that if you've been vaccinated and or if you've been infected before, the overall risk of hospitalization is very low, but the infection can still make you sick. You could still be down for a week or more. You could have fatigue for weeks, and so it's still the most important thing is taking some simple precautions like wearing a mask, staying away from crowded spaces, restaurants, and any indoor functions you want to stay away, or wear a mask as much as possible. And then the other thing is to obviously wash your hands thoroughly and use a sanitizer. Testing is very important. If you have any patient with high fever, cold cough, muscle aches, joint pains, headache, or diarrhea should be tested for COVID. And if possible, once we have widespread availability of genome sequencing, we could also test for the specific variant. But in terms of treatment, The treatment, as of now, the only treatment we have is IV remdesivir for patients with mild infection. In India, we could use IV remdesivir. In the US, we have two different oral drugs, one called Paxlovid and another one called Molnupiravir, which as of now is not available in India. So in India, the only option if you have a current COVID infection, a mild infection, and if you're not short of breath, if your oxygen levels are pretty decent, you could stay at home and just symptomatic treatment with a lot of ORS fluids, your Dolo and stuff like that. Whereas once you start having low oxygen levels, or if you're short of breath or severe fatigue, then you need to be hospitalized. IV remdesivir has been shown to prevent progression of infection. So in mild cases, we could use it IV for 3 days. In patients with pneumonia, obviously you need to be hospitalized. So the most important thing at this point that I want you to all be aware of is that this infection spreads quickly, it spreads fast, and whether you're vaccinated or not, there's a high risk of getting this infection. So please wear your masks, please stay away from crowded spaces, and use your sanitizer, and if you get infected, be tested. Thank you.